The top stories tonight in Y News. The government halts AstraZeneca inoculation to persons aged 60 and below. The Philippine National Police warns against colorum vehicles transporting passengers out of NCR Plus bubble.
Agriculture groups fears effect of lower tariffs on imported pork. Senate Workers Union Group deny links to communist groups.
North Korea claims it has zero COVID-19 cases, but experts express doubts. And physicists discover a possible new force of nature. Good evening, Philippines and the world. We are now reporting, today is Thursday, April 8, 2021. I am William Theo.
Or as we deliver today's top stories around the country and in other parts of the world. I'm Angelo Castro. We are also seen in 1,935 satellite monitoring centers nationwide and via live streaming worldwide through the UNTV News and Rescue social media accounts and our website, untvweb.com. I'm Angelo Castro III.
First in the news. British authorities recommended that the AstraZeneca COVID-19 vaccine should not be given to adults under 30. But despite the warning, some countries opted to continue using the British vaccine. Arke Llorca will tell us why live. Yes, Arke, what is the reason of the British authorities to limit the use of AstraZeneca vaccines?
Yes, William. Because of the strengthening evidence that a shot of Oxford AstraZeneca vaccine may be linked to rare blood clots, the authorities in the UK and the European Union warns under 30 should not be jabbed with the vaccine. The regulators emphasized that the benefits of the vaccine continue to outweigh the risks for most people. However, the European Medicines Agency said it had found a possible link between the shot and the rare clots. Therefore, authorities recommended that people under age 30 should be offered alternatives to AstraZeneca vaccine, even though the EMA advised there should be no age restrictions, leaving it up to its member countries to decide whether to limit its use. The EMA's executive director, Emer Cook, on the other hand, also emphasized that the risk of mortality from the virus is much greater than the risk of mortality from its vaccine side effects. Meanwhile, Mexican and Brazilian health regulators said they would not limit the use of AstraZeneca's COVID-19 shot after Britain's vaccine advisory. In March, more than a dozen countries in Europe suspended their use of the AstraZeneca over the blood clot issue, but most have also restarted, some with age restrictions, after the EMA said countries should continue using the vaccine. William, AstraZeneca in a statement said that both UK and the European Union regulators had requested their vaccine labels be updated to warn us with extremely rare potential side effects. Back to you, William.
Yes, thank you, Arke Llorca, reporting live from Thailand. Meanwhile, the government has temporarily stopped giving AstraZeneca COVID-19 vaccines to persons aged 60 and below. Aiko Miguel will tell us why.
525,600 doses of AstraZeneca COVID-19 vaccine were initially delivered in the country through WHO's COVAX facility. But today, health authorities temporarily halts its use for those below 60 years old. FDA Director General Eric Dominguez said this is due to a possible link between the vaccine and very rare cases of blood clots. They have to suspend its use to assure safety and validity of vaccines.
Pero very rare, no? Kasi out of 200 million na mga nabakunahan ng AstraZeneca, meron po parang mga 16 cases, no? Na tinitingnan nila na possible connected nga po ng blood clotting saka yung pagbabago ng platelet. Chinek ko po sa ating National Adverse Events Following Immunization Committee, wala naman daw po tayong kaso na re-report na ganito na napagbaba ng platelet. at saka thrombosis dito sa atin. Nakikita ito usually daw sa mga kababaihan na less than 60 years old.
FDA is aware that there are only few supply of AstraZeneca COVID-19 vaccines in the country, and it is possible that by next month, additional supply of the said vaccine will arrive from the World Health Organization. The DOH and FDA assured the public that experts are carefully reviewing information pertinent to this new development in order to craft appropriate recommendations on the vaccine's use. To date, the National Adverse Events Following Immunization Committee, or NAFIC, has not received any local reports of such side effects. Nonetheless, the DOH and FDA are carefully monitoring the rollout of vaccines to identify and appropriately manage any possible adverse events. DG Domingo also emphasized that the temporary suspension does not mean that the vaccine is unsafe or ineffective. He adds they are taking precautionary measures to ensure the safety of every Filipino. FDA continues to underscore that the benefits of vaccination continue to outweigh the risk and urges everyone to get vaccinated when it's their turn. DG Domingo also explains those who already received their first dose of the AstraZeneca vaccine will have to wait for experts' review to be completed before the schedule of the second dose. Interval of AstraZeneca COVID-19 vaccine doses is taken 4 to 12 weeks apart. As of April 6, 2021, there are already almost 923,000 vaccinees who have been inoculated with Sinovac and AstraZeneca COVID-19 vaccine in the country. The government targets to inoculate up to 70 million people, or two-thirds of its population this year, to achieve herd immunity against COVID-19. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
As countries around the globe ramp up their massive immunization programs, the production and distribution of vaccines have been met with shortages. The World Health Organization, or WHO, says the spike of new COVID-19 infections could also be a factor. Rosalie Cos explains why.
Vaccine-producing countries have stopped exporting their vaccines to address the surge of COVID-19 cases in their nations. This is the reason why the supposed delivery of less than 1 million doses of AstraZeneca vaccines to the Philippines in March did not push through.
The problem is that we as a global community are faced with a vaccine shortage. And that vaccine shortage has also been driven by the recent increase in cases.
The Philippines has been advised by the World Health Organization to maximize the use of available vaccines by prioritizing the health workers in areas where there are COVID-19 surge. The government has also included other vulnerable sectors such as senior citizens and comorbidities in the current vaccination efforts, while the inoculation of economic frontliners and indigent population is eyed next month.
Ang ginawa natin ngayon, sa ngayon, nagko-combine na po tayo ng A1 to A3. And we are recommending na by May, considering na ito yung tinatawag na Labor Day, we can open up yung natatawag natin mga economic frontliners. So yun po gagawin po namin this coming May, we will recommend na yung A1, A2, A3, A4, and A5 will be included already sa mga segments na priority natin.
Around 2 million doses of Sinovac and Sputnik V vaccines are expected to arrive this month. Meanwhile, 4.1 million doses of Sinovac, Gamaleya, and Moderna vaccine are due to arrive in the Philippines in May. Rosalie Cos, UNTV News and Rescue. We serve the people, we give glory to God.
Amid the rising trends of families getting infected with COVID-19, a health expert advises essential workers to strictly observe the minimum health protocols implemented by the government. Nel Marie Bohok explains why.
Dr. Tony Liachon, a health expert and former COVID-19 Interagency Task Force advisor, calls anew to the public, especially the essential workers, to follow the government's minimum health protocols to prevent the further spread of COVID-19. This following a recent study that most of the infected individuals in the country belong to the working age group, and their families, especially the older persons who are staying at home, are the ones dying from the infection.
So in summary, ang nagdadala ng cases in 50% of the time ay in 20 to 40 years old. Kaya mga bata, kung may nakikinig sa inyo ngayon, kayo po ay mag-ingat. Kayo ang nagdadala ng sakit sa bahay at sa workplace. Kasi sasakay kayo ng jeep, sasakay kayo ng bus, nakamotor kayo, hindi tayo naghuhugas ng kamay, kakain tayo sa pantry, magtatanggal tayo ng mask, maghahalakakan tayo, sasakay tayo sa punong bus uli. Yan, yun yung time na yun eh.
If you are essential workers who may be exposed to COVID-19 during your daily work, here are some tips to keep you and your family safe. After arriving at home, do not interact yet with your family. Remove your working clothes and directly wash it or soak it with a detergent. After removing your clothes, take a bath immediately. Disinfect your things from work like your gadgets, bags, eyeglasses.
Kaya kung nag-work kayo, galing kayong labas, maligo muna kayo, yung damit nyo ilagay kagad sa laundry, magmask kayo, pag nagmano kayo, kung hindi kayo sigurado sa inyong kalinisan.
The Department of Health data shows on April 6, the death cases rose to 382. The big percentage belong to the age 50 years old and above. It means that senior citizens are at risk of getting the virus even they are staying at home. It is more important that elderly should be prioritized also in the inoculation, so they may have extra protection during their stay inside your home. Nel Maribuhok, UNTV News and Rescue. We serve the people, we give glory to God.
The Philippines recorded 9,216 new COVID-19 cases today, bringing the total active cases to 167,279. In its latest bulletin, the Department of Health said the latest tally pushed the country's total caseload to 828,366. The tally, however, does not include data from 5 laboratories that failed to submit reports on time. The DOH also reported that the country's recovery count jumped to 646,968 after 598 more patients recovered from the viral respiratory disease. The death toll also climbed to 14,119 with the addition of 60 new fatalities. Local government units under the enhanced community quarantine have implemented different methods to fast-track the distribution of supplemental aid to qualified residents affected by the country's most stringent form of lockdown this week. Dante Amento tells us why.
Local government units in the NCR Plus bubble were directed to determine the most effective and efficient way of releasing the assistance to their constituents. Thus, NCR LGUs have implemented their own methods to fast-track the distribution. In Manila, Mayor Isko Moreno Dumagoso asked the city social workers to work overnight.
Alam ko, mahirap yung hinihingi ko sa inyo. Hanggat kaya ng katawan natin, ibigay natin yung pera doon sa mga itinala, inilista ng national government. The least thing that we can do is mapuyat at mapagod.
In Caloocan City, beneficiaries are informed through text or call if their cash assistance are available. Meanwhile, personnel from the Public Information Office in Valenzuela City personally visit residents in their houses to inform the beneficiaries.
Ginagawa po namin, in-house po namin yung paanyaya. May hawak po kaming master list, tapos may mga paanyaya po na nakalagay po sa master list. Ito po yung paanyaya. Iniisa-isa po namin yung pangalan, pinupuntahan po namin yung address. Ngayon pag hindi po namin nakita yung tao, may mga cellphone number po, tinatawagan po namin.
In Greenville Covered Court in Quezon City, they implemented alphabetical order scheme for those who are allowed to go to the venue. Beneficiaries need to fall in line and wait for several hours before they enter the venue.
Hindi, babalik na lang buko. Pwede pa rin naman bumalik eh. Naprobahan naman ito ng pangalawang namin. Sana nga maprobahan ulit.
Meanwhile, appeal desks were installed in different venues to accept complaints from residents. Some residents complained that they are not in the list and the amount of cash aid they receive is lacking.
Sir, kasi ang miyembro ko sa pamilya 5. Kasi nagbigay si mayor ng details about dun sa sack na kung ilan yung makukuha mo, di ba? Eh, ang binigay nila sa akin is 2,000.
The City Social Welfare, on the other hand, assures that the residents' queries will be responded in 1 to 2 days.
Didinggin po yung kanilang apela ng Grievance and Appeals Committee po ng City. So, kung ano man po yung tugon doon sa loob po ng 48 hours, ay itatawag naman po sa kanila.
Dantiamento, UNTV, News and Rescue. We serve the people. We give glory to God.
Those watching our 24/7 live streaming on YouTube, please click the subscribe button you see on your screen and ring the bell for notification. You may also follow us on Facebook.
The Philippine National Police warned against erring vehicle operators and drivers illegally transporting passengers outside the National Capital Region Plus bubble. Leia Ilagan will tell us why.
Despite the travel restrictions being implemented by the government in the NCR Plus bubble, some people are taking advantage of the situation. Just like this video that went viral on social media. The cargo truck was supposedly carrying goods. However, it was seen illegally transporting passengers from Metro Manila to Bicol region. The passengers are being unloaded and herded into Colorum vans plying the Quezon-Bicol route, with many of the passengers seen not wearing masks and face shields. PNP Highway Patrol Group Director, Police Brigadier General Alexander Tagum says they are now implementing strict vehicle inspection in Region 3, Region 4A, 4B, Region 5, and National Capital Region to apprehend Colorum vehicles.
Nakahuli po yung tropa ko ng 13 Colorum vehicle. 11 dito ay passenger van, isa is UB, at isa pong kotse na illegally transporting people towards the region galing po Metro Manila.
The apprehended Colorum vehicles were already impounded, said Tagum, and over 100 passengers were turned over to the LGUs and the DSWD.
For the swab test at mabigyan po ng mga pagkain at for the proper disposition.
Cases will be filed against erring operators and drivers. Meanwhile, PNP Chief Police General de Bolsinas orders to conduct a random inspection on cargo trucks passing through PNP checkpoints. Leia Ilagan, UNTV, News and Rescue. We serve the people. We give glory to God.
The Department of Health, or DOH, reiterated that cyclists and other users of active transport are not required to wear face shields due to their potential safety risk. The DOH issued the reminder following reports of cyclists and other active transport users being arrested for not using face shields. The DOH, however, emphasized that face shields must be worn before and after cycling or other similar activities. The Health Department further reminds the public that the use of face mask and the observance of physical distancing, respiratory hygiene practices, and other appropriate health interventions must continue to be practiced while cycling or engaging in other forms of active transport.
Dole will hire an additional 12,000 contact tracers to be deployed within the National Capital Region Plus bubble. Marvin Calas explains why.
Based on the latest report of the Octa Research Group, the reproduction of COVID-19 in the National Capital Region decelerated to 1.32 3 days before the end of extended community quarantine at NCR Plus bubble on April 11. Nevertheless, higher cases of COVID-19 are recorded every day since the effect of ECQ is expected to reflect by next week, says experts. Due to higher cases, the Department of Labor and Employment aids the Department of Interior and Local Government to hiring additional 12,000 contact tracers. The hiring is set to start by next week and they will be deployed at NCR Plus bubble for a swifter contact tracing. 8,000 contact tracers will be for the entire Metro Manila, while the rest will be divided for Cavite, Rizal, Laguna, and Bulacan.
This will provide employment, no? Although short-term employment, but still it's employment. So we will be able to help those in the informal economy yung na-displaced from the private sector, including our informal sector workers whose livelihoods have been affected by COVID-19.
DOLE's priority is to hire the disadvantaged and displaced workers due to the pandemic, providing 16,000 pesos as their monthly allowance. The department is finalizing the qualifications and requirements for the applicants, such as college and high school graduate requirements. Contact tracers will undergo a 2-day virtual training and a written examination follows for their assessment.
Ang hiring process po ay manggagaling po sa LGU and then ibibigay na lang po sa amin ang mga na-hire po nila. Kasi nga ho, ang ideal po na contact tracing ay dapat doon din sa locality mo kukuhanin yung source mo ng manpower para yung cost ng transportation ay malesen.
DOLE is also considering the Metro Manila Mayor's recommendation to extend the contract of contact tracers for up to 3 months. Marvin Calas, UNTV News and Rescue. We serve the people, we give glory to God.
In other news, several senators renewed the call to criminalize red tagging as they slam the claims of government officials linking the Senate's workers' union to communist groups. But the government's anti-insurgency task force finds the proposal worrisome and dangerous for the country. Arlene Delgado will tell us why.
The Union of Senate Employees called sandigan ng mga empleyadong nagkakaisa sa adhikain ng Demokratikong Organisasyon o Senado vehemently denies its alleged link to the CPP-NPA-NDF and condemned the red tagging of government officials. This comes after National Intelligence Coordinating Agency or NICA Director General Alex Monteagudo claimed through a Facebook post that they serve as the eyes and ears of the communist groups to hijack government plans and programs. It also claimed that the Confederation for Unity, Recognition, and Advancement of Government Employees or Courage, to which Senado is an affiliate, is a front organization of the CPP-NPA-NDF. The National Task Force to End Local Communist Armed Conflict or NTFL-CAC supported the claim.
Ang red tagging sa Union ay nagbabansig sa akin bilang operative ng CPP-NPA-NDF sa Senado. Isa itong malaking kasinungalingan at kabalintunaan. Kinikilala po ng mga senador ang aming kontribusyon sa matagumpay na performance ng Senate. Ang malisyosong pag-uugnay sa amin bilang teroristang grupo ang naglalagay sa amin sa kapahamakan.
Courage also denied the claim and also condemned the red tagging of workers' unions and other government agencies.
Kami ay mga unionista, mga lingkod ng bayan, hindi terorista. Dahil sa red tagging po ninyo, ang Courage po ngayon ay may 6 na political prisoners.
In separate tweets, Senator Nancy Binay and Coco Pimentel also attested to the legitimacy of the workers' union and its works for the welfare and rights of Senate employees. The minority bloc, composed of Senators Franklin Drilon, Risa Hontiveros, Laila De Lima, and Francis Pangilinan, also condemned the red tagging of the union, noting that it is a baseless attack not only to the employees but also to the Senate itself. The opposition senators renewed its call to pass the proposed measure seeking to define and criminalize red tagging. Senate Bill 2121 proposes a 10-year imprisonment and perpetual disqualification from public office for any state actor, such as law enforcement agent, who labels or accuses individuals or groups as state enemies or communists. Earlier, Senate President Vicente Soto III also denied the claim, adding that he is now inclined to support the bill. According to Soto, he told Monteagudo for NICA to give him the names of the employees to have them investigated. Meanwhile, Senator Panfilo Lacson partly agrees with the NICA chief, saying that not all the members of the Senate Workers Union are the eyes and ears of Courage. However, for NTFL-CAC spokesperson Undersecretary Noreen Badoy, the proposed criminalizing of red tagging is worrisome, saying that it is dangerous for the country.
This is a weapon used by the CPP-NPA-NDF to silence those who blow the cover of their legal fronts. It's really high time that we talk about it. The opportunity has presented itself. We really hope that this Senate inquiry into infiltration of the government by the CPP-NPA-NDF pushes through.
She also took a swipe at the opposition senators as she maintains that there is no such thing as red tagging. Haridin Delgado, UNTV News and Rescue. We serve the people, we give glory to God.
Meanwhile, President Rodrigo Duterte signed an executive order temporarily lowering tariffs on imported pork meat for 1 year. However, agricultural groups fear that this will only worsen the pork supply crisis. Ray Pelayo explains why.
The Pork Producers Federation considers the pork importation as a big threat to the local hog industry. This is after President Duterte signed Executive Order 128 that temporarily lowers tariffs on imported pork meat for 1 year. Under the EO, the import duties on fresh, chilled, or frozen pork will be reduced to 25% for 3 months and 20% for the rest of 12 months. The tariff rate for imported meat outside the existing quota, on the other hand, is reduced to 15% from 40% for the first 3 months. It will then be raised to 20% for the next 9 months. However, Pork Producers Federation Vice President for Luzon, Nick Briones, said that the low prices of imported pork will now compete with the local production and would discourage more hog raisers to produce.
Marami ang titigil. Backyard raisers mauna, commercial raisers. Next year, bantayan nyo. Sigurado, lalong walang supply ng baboy na lokal. At sigurado, mamahal ang mga bilihin bago mag-eleksyon.
The Samahang Industriya ng Agrikultura said that there is no assurance that supply in the world market would be bought at a lower price.
Nakikita natin, pag wala ng stocks ang local, itataas din ng international yan. Yung magbebenta sa ating bansa, itataas din nila yung price.
The government will impose a suggested retail prices on imported kasim and liempo at 270 and 300 pesos per kilogram respectively. But an importers group said that the SRPs on imported pork can be implemented if traders and vendors will not add high markups. The group proposes to extend the EO.
We suggested to DA and to the NEDA that itong reduction of tariff should not be for 1 year only. Dapat gawin nilang 5 years. Kasi talagang itong problema is not going to go away in 1 year.
The Agriculture Department reiterates that their priority is the repopulation of hogs in the country severely affected by the African swine fever.
So, hindi lang importation ang tinitingnan natin. Importation is the last resort. Augmentation lang yun.
Ray Pelayo, UNTV News and Rescue. We serve the people. We give glory to God.
Meanwhile, senators expressed their disappointment after President Duterte signed the order lowering tariffs on pork imports to address the supply problem. Senate President Vicente Soto calls it bad news, noting that local hog raisers will be utterly disappointed. Senate Committee on Agriculture Chairperson Cynthia Villar also does not agree with the president's decision, saying that pork tariffs are low already. Senator Francis Pangilinan estimates that the country will lose 11 to 14 billion pesos in tariff revenues once the order takes effect. The senator renews his appeal to the president to declare a state of national emergency due to the effects of African swine fever in the country's hog industry and food security. The issue is expected to be discussed in the Senate Committee of the Whole on Monday about the alleged syndicate and corruption behind the country's pork importation.
Meanwhile, to address the problem in public transport, the Land Transportation Franchising and Regulatory Board, or LTFRB, will allow the operation of half of the provincial buses nationwide, but its approval will still depend on the concerned local government. Asher Kadapan Jr. explains why live. Asher?
Jedgo, some local government units still stringently implement restrictions in the entry of individuals into their jurisdictions to avoid further spread of COVID-19 carried by travelers, especially those coming from areas with a high number of cases. The provision is stated in the guidelines set by the Interagency Task Force on the Management of Emerging Infectious Diseases as a health emergency measure. This as the Land Transportation Franchising and Regulatory Board allows 50% of the provincial bus operation nationwide starting next week.
Doon po sa mga buses po na papasok ng Metro Manila, ito po ay subject po kung papayagan sila ng concerned LGU dahil sa ngayon po ay nasa LGU po yon kung pagpapasukin or i-resume na po ang operations ng ating mga provincial buses.
LTFRB OIC Chairman Zona Rosetta Maya said an additional 4,400 units of public utility vehicles, including provincial buses, particularly those entering Metro Manila, are expected to resume their operation. The LTFRB further said that the measure will be implemented even if the enhanced community quarantine restriction will be extended in the National Capital Region. Meanwhile, the Department of Transportation, hand in hand with the attached agencies, intensified its anti-colorum operation across the country. This comes after DOTR Secretary Arthur Tugade learned about unauthorized passengers being illegally transported by colorum vehicles. Land Transportation Office Chief Assistant Secretary Edgar Galvante revealed that they have been closely monitoring and have apprehended about 13 colorum vans conveying passengers in and out of Metro Manila since they intensified their operation yesterday. Galvante further explained the illicit service is even being offered through social media.
Ang ibang nahuli namin is that yung nag-advertise sila na nagbibigay sila ng ganitong serbisyo at kumbaga kinol namin, ano? I mean, meron kami mga tao na pinag-respond namin at sinabing siya'y pasahero na pwedeng mag-take advantage, no? Para masino natin kung itong mga gumagawa ng illegal na ito ma-identify at mahuli, no?
Violators against colorum vehicles may be penalized with a fine amounting from 50,000 to 1 million pesos depending on the type of vehicle used. Jego?
Thank you, Asher Carapan Jr. for the update.
Yes, Diego, anti-parasitic drug Ivermectin is now allowed to be used for people against COVID-19 in a hospital. This after the Food and Drug Administration approved their Compassionate Special Permit or CSP application. FDA explained before that the use of Compassionate Special Permit for certain drug is limited. This depends on the applied purpose of a hospital or of a medical professional. Hospitals, Diego, or medical professionals applied for a CSP is held liable if anything happens to an individual. Here is Undersecretary Eric Domingo, the Director General of the Food and Drug Administration.
Po kaming nag-grant dahil nga po ang Ivermectin ay isang investigational product. Alam naman natin may mga clinical trials ongoing dito para gamitin against COVID-19.
Meanwhile, Diego, the efficacy rate of Chinese Sinovac vaccine on elderly people is aligned with the 50% WHO standards, the Food and Drug Administration said, adding, however, it should be given to senior citizens with acute illness and uncontrolled hypertension. Domingo made the announcement a day after the regulatory agency allowed the use of Sinovac on senior citizens or those aged 60 years old and above.
Nakita natin na yung phase 1 and 2 data ng safety naman po ay maganda. Yung pong kanilang tinatawag na zero conversion rate ng senior citizens ay mataas. Nakita natin dun sa early reports na baka po it is around mga 51-52% at the least. Kaya po nung tinignan natin lahat ng ito at yung pangailangan ng ating bansa na protektahan ang mga senior citizen, ay binigyan na po natin ang go signal, no, ng FDA, ang DOH, na gamitin ang bakuna na to sa mga senior citizen, knowing that the benefit outweighs the risk when it comes to the actual situation.
Diego, FDA also explains senior citizens are free to choose whether to be inoculated with it. A screening in vaccination sites is also done before inoculation. Senior citizens will have to sign a waiver or consent before receiving a job.
Ang pagbabakuna will only be done kung meron pong full informed consent ng taong babakunahan. Kailangan po sumang-ayon siya at gusto niyang magpabakuna. Yung informed consent po, nakalagay na po lahat doon. Isasabihin sa inyo ang mga possible positive benefits at saka ang mga possible negative na mangyayari at magde-decide po kayo kung magpapabakuna kayo o hindi.
According to the National Task Force, the inoculation of CoronaVac for senior citizens will start on April 12, 2021. And that is the latest live. Back to Diego.
Thank you, Aiko Miguel, reporting live.
North Korea is still claiming there are no cases of COVID-19 in the country, but experts are doubting the accuracy of these reports. Dale De Castro reports why.
In their latest report to the World Health Organization, WHO representative to North Korea Edwin Salvador said that 23,121 people in North Korea have been tested from the start of the pandemic to April 1, reporting that all results were negative. Experts have repeatedly questioned North Korea's claim of zero cases given the country's poor health infrastructure and the border it shares with China. Secretary General of the Seoul-based Association of North Korean Defectors, Cho Jae-pyong, told the New York Times last year that it is a blatant lie when North Korea claims they have no cases, as he heard from a North Korean contact that a family died of the virus in March last year. Outsiders have pointed out that aside from North Korea's lack of public health system, food shortages and nutritional deficiencies have also made a large portion of the population in North Korea vulnerable. Human rights groups are also saying that the extreme restrictions placed in North Korea in response to the virus have exceeded public health protection needs, and sealing the borders have intensified systematic repression and the isolation of North Koreans. North Korea's leader Kim Jong-un have warned top officials of the consequences of failing to prevent the virus from entering the country, with authorities even issuing shoot-to-kill orders. Through the UN's COVAX program, North Korea could receive 1.9 million doses of COVID-19 vaccine in the first half of the year. Dale De Castro, UNTV News and Rescue. We serve the people, we give glory to God.
Canada's Ontario has imposed a one-month lockdown to its 14 million residents as it battles the surge of COVID-19 cases and hospitalizations. Marvy Delfin will tell us why live. Yes, Marvy, go ahead.
Ontario government has declared its third state of emergency and will be implementing a 4-week stay-at-home order, which will go into effect at 12:01 a.m. local time Thursday. The new measures require Ontarians to leave their homes only to get essential goods and services or to go to work. Grocery stores and pharmacies will remain open to the public, while non-essential retail stores, including malls, will close in-person shopping and only have curbside pickup available. The announcement from Ontario's Premier Doug Ford comes after the province recorded on Wednesday another 3,215 COVID-19 cases, which marks the highest single-day number since January 17, 2021. A 28.2% rise in COVID-related hospitalizations was also reported, with ICU occupancy already setting a pandemic record this week, and continues to increase at a rate faster than the province's worst-case scenario modeling. In addition to the worrying trend, Premier Ford's cabinet also faced criticism for resisting calls for paid sick days for essential workers and Ontario's slow vaccination rollout, especially in hard-hit areas and workplaces. The province now plans to begin deploying mobile vaccination teams and pop-up clinics throughout communities in hotspots such as Toronto, including providing vaccines to teachers and other employees in the education sector beginning next week. Outside of Canada's Atlantic provinces, the third wave of the pandemic is straining hospitals throughout most of the country, and the health department has underscored the threats of variant spreading and leading to more infections and severe illness. The U.S. Centers for Disease Control and Prevention earlier issued a warning against traveling to Canada and has categorized the risk of COVID-19 to the agency's highest alert level. Back to you, William.
Yes, all right, Marvy. Thank you for that live report.
The discovery of a possible fifth force of nature takes scientists to a new area of possibilities, increasing their hopes in solving the many mysteries of the universe. Early Briones reports.
Nature's forces are said to be gravity, electromagnetism, the strong force, and the weak force, which govern the interaction of the particles in the universe. But physicists at the United Kingdom Science and Technology Facilities Council, or STFC, say that they recently found strong evidence for a fifth new force of nature. The Muon G2 electromagnetic experiment currently provides statistical possibilities that Muon, a subatomic particle similar to electrons, does not fit in the standard model of theory that current known forces in the universe follow. The Illinois-based experiment conducted at the Fermi National Accelerator Laboratory, also known as the Fermilab, has shown that muons are 200 times heavier than electrons, but move at a faster rate than expected, hypothetically influenced by a new force unknown to science. Despite these findings, the experiment so far only has the level of confidence of 4.1 sigma out of 5. This means that it has a 1 in 40,000 chance of the result being a statistical fluke, overriding the 1 in 3.5 million chance possibility of it being an actual discovery. That being said, a researcher from the University of Manchester has commented on the exciting new possibilities of the experiment and the new discoveries it might add to the current scientific knowledge. Professor Ben Alanak at Cambridge University cannot contain the excitement himself, studying forces and particles all throughout his career. He is confident with the current findings and the possible confirmation of the new mysterious force surrounding the muons. Additionally, Dr. Mitesh Patel from the Imperial College London, involved in the experiment, suggests that the need for further experiments to actually determine the reality of this new force. Theoretical physicists believe that the unidentified new force may help explain the multitude of unsolved mysteries that have boggled the minds of scientists for decades. Early Briones, UNTV News and Rescue. We serve the people, we give glory to God.
And those are the reasons behind the news, April 8, 2021. I am Jorlene Delgado.
Reasons we deliver to you as they unfold. I'm Angelo Castro III.
Because we need to know, we will always ask why. I am William Theo. We serve the people. We give glory to God.